Well, hello, and thank you for joining my Drugs to Treat Arrhythmias video. So, the heart rhythm is the electrical activity of the heart. And we know that normally the heart beats at about 60 to 100 times per minute at a regular rhythm. It goes lub dub, lub dub. Well, this state is called a normal sinus rhythm. And depending on the needs of the body, it may beat faster, which we call sinus tachycardia, due to stress, or it may be slower, such as a sinus bradycardia, during a time like asleep. The SA node is the pacemaker of the heart, and the electrical activity, is controlled through ions that are moving in and out of the cell, sodium, potassium, and calcium, causing that action potential. So cardiac cells can create this electrical impulse, which is the action potential, which is depolarization at rest as potassium flows out of the cell and sodium leaks into the cell, causing that depolarization and that action potential. Well, we know that that action potential has 5 phases. Sodium rushing into the cell again, and potassium leaving the cell. And again, the SA node is the pacemaker of the heart. Excuse me. So we know that the EKG or the ECG is the electrical rhythm of the heart. The P wave is contraction of the atria, the QRS is right before the contraction of the ventricles, and the T wave is relaxation of those ventricles. Well, arrhythmias are also called dysrhythmias, and that's a disruption in the normal rhythm of the heart. And there are different types, a lot of different types of arrhythmias or dysrhythmias. There's ventricular tachycardia, supraventricular tachycardia, which is SVT, heart block, atrial flutter, atrial fibrillation, and so many more. So antiarrhythmic drugs or drugs to treat arrhythmias do so by suppressing the abnormal electrical activity or electrical rhythms of the heart. And these drugs are broken up into different classifications. Each classification of these drugs works as during a different phase of the action potential. If you look at figure 45.6 on page 778 in chapter 45, or on the top right of your screen, you will see where those different classes work during those different phases. Now, just to be clear, you do not need to understand at this level for your exam, but it does help when you are learning about the different classes in the antiarrhythmic medications, why they are working in a different way and how they're working in a different way. So lidocaine is our first medication, and it is a class 1 antiarrhythmic. And the drug works during the phase 0 of the action potential. And remember that action blocking the sodium channels in the cell membrane during that action potential causes a slowed conduction. So treatment with lidocaine, we only use it for short-term, life-threatening, pens up ventricular arrhythmias, such as during an MI or during cardiac surgery. And another pens up, all antiarrhythmics can cause an arrhythmia. So just what we're going to treat, it may actually trigger a different electrical dysrhythmia. So in this first classification of drugs, this lidocaine, if you were taking care of a patient that was on this medication, what would you be looking for? Well, it's changing the electrical activity of the heart, so we have to assess cardiac. So how are we going to assess cardiac? That's right, you're going to be looking at the heart rate, the blood pressure, the monitor. You're looking at the EKG or the ECG. You're watching for the side effects like lightheadedness or dizziness. Excellent. Our second classifications you will be familiar with. Propranolol is a class 2 antiarrhythmic, and it is a beta blocker. Remember, it ends in OLOL, and it is a beta blocker, so we know that it's going to block the beta cells in the heart. We also know that it is a non-specific beta blocker, so we also have to watch for side effects in the respiratory system. We're looking at those lungs. We're looking at if there is having any bronchospasm. This medication, we remember, is used to treat angina, also migraines, hypertension, and while we're studying this classification of medications, arrhythmias like SVT or supraventricular tachycardia, where the heart is beating very, very fast. And it does slow conduction through that AV node. The third class that we're looking at is amiodarone. And amiodarone is indicated for the treatment of life-threatening ventricular arrhythmias. And this medication acts directly on the heart muscle cells to prolong that repolarization. And this medication will block the potassium channels and slow that movement of potassium out of the cell during that phase 3 of the action potential. It also acts on the peripheral smooth muscle to decrease peripheral resistance. Again, paying attention when that medication is affecting the smooth muscle, we do need to assess the respiratory function as well. Diltiazem is a class 4 antiarrhythmic, and it is a calcium channel blocker. You remember this one as well. It blocks the movement of calcium ions across the cell membrane, slowing that automaticity or that ability of the cardiac cells to create an impulse. We also have used this medication to treat angina. And what happens is during the use of this medication, it's delaying the phase 1 and 2 repolarization, which again slows that automaticity and conduction. And remember, diltiazem is used for hypertension and to treat angina. It does vasodilate the blood vessels throughout the body. This medication is given IV, so we would need to make sure that IV access is established. Let's try a arrhythmia case study. So a patient presents with the above heart rhythm, supraventricular tachycardia or SVT, and receives diltiazem. What nursing considerations are needed? Now, for your exam, you will not have to interpret ECGs, rhythm strips, but I wanted to give you a visual so you could at least think about when you are taking care of a patient, what that would actually look like. Excuse me, picture your patient sitting in the hospital bed. They are connected to the monitor. You're looking up at the patient's monitor and they're being treated for an arrhythmia. So picture this electrical activity that is abnormal in the heart. And this is one such rhythm that you may see in clinical practice. So what are you going to do with this patient? Are you going to go to the electronic medical record and start looking up different lab values? What would you do? What would be your priority? You can stop the video and think about it and resume it when you're ready. Okay, so what did you come up with? So when you're taking care of a patient who is suffering from an arrhythmia or a dysrhythmia, and they're being treated with an anti-arrhythmic medication, absolutely you need to monitor the patient's cardiac status. So you're looking at their blood pressure. Are they maintaining their cardiac output? What is their heart rate? Is it a fast arrhythmia? Is it tachycardia? Or is it a slower rate? Is it bradycardia? Making sure that they have an IV site, because remember that when you are treating a patient with an antiarrhythmic, anytime a patient can have a side effect of another arrhythmia because you're messing with the electrical activity of the heart, they can send them into another dysrhythmia. So you always want to make sure that you have good IV access in case you need to administer another medication. And then other signs of good perfusion, good cardiac output. Make sure you're monitoring the patient's color, their pulses, their capillary refill, all those ways that you have learned how to monitor the patient's cardiac status. You want to make sure that you are doing that for these patients. Well, that's it for antiarrhythmias. So just remember the basics. Remember, you do not have to understand at which phases and where the sodium and potassium are moving into for the different medications, but you do want to have a very good understanding of how you're going to think like a nurse while you are giving these medications, what kind of assessments are needed depending on the medication that is given, and what are the indications for each of those different antiarrhythmic drugs. Goodbye.